Hello there, welcome to People, Politics and Power. I am Imoni Amarere. Nigeria has officially declared a second wave of the deadly coronavirus. This follows several days and weeks of high infection levels across the country, occasioned by non-compliance with protocols and guidelines. Only last night, Nigeria recorded its highest single-day infection ever since the pandemic hit the country in February, with a staggering figure of 1,145. The numbers have been on an alarming upward swing for days, such that some states are considering another round of lockdowns, while some have actually ordered schools to close shop for the Christmas holidays. Since the discovery of the first case of the coronavirus in Nigeria, the country, like the rest of the world, has been in a battle to preserve lives and manage the pandemic. The good news came over the last 2 weeks as leading laboratories and pharmaceutical companies came up with a number of vaccines, all within days of each other, with a rating of over 90% efficacy, and are already being administered in the United States, in the United Kingdom, and some other European countries, amongst others. News of the vaccine development comes at a time when nations that thought they had come out of the woods found themselves having to once again put in place stringent measures, especially during the holiday season, which usually brings family and friends together. Europe and the United States are experiencing a most deadly second wave of the pandemic. In Nigeria, the federal government has warned citizens not to create a situation where the nation is forced to re-enter lockdowns or any such stringent measures. Minister of Health Osagie Ehanire has also promised that Nigeria will get the vaccines supplied to the country towards the end of January 2021 to aid Nigeria's fight against the coronavirus. Many analysts have raised issues with the government's position and posed some very pertinent questions, which we intend to discuss on the program today. The questions include: at what point did the federal government place the orders for the vaccines and with which companies for it to expect them at the end of January next year? Are we relying on the benevolence of other powerful nations such as the UK, the US, China, Germany, or on the pharmaceutical companies themselves, or indeed on the World Health Organization, WHO? Some statistics show that with the situation of things, less developed countries, predominantly in Africa, are not likely to see vaccines until 2022, which informed why the United Nations Secretary General Antonio Guterres, Bill Gates, and some other top figures have been calling for a change. Another critical question, following the reports of some allergic reactions noticed in some patients upon receiving the vaccine, is how much or how such studies of his own have the Nigerian health authorities conducted, seeing that the COVID-19 pandemic affected Nigeria somewhat differently than it did in Europe and the Americas. Some prominent voices have also called on Nigerians not to take the vaccines, thus creating unfounded suspicions. What does this do to the national effort at ridding the country of this pandemic? Is the government doing enough to address these concerns? The vaccines have so far been developed in such a way that recipients receive 2 doses over a period of time. The question, therefore, is how many millions of doses is Nigeria expecting, and what sections of the population will become the first recipients of the vaccines? The political elite, the elderly, the young people, or health workers? Now, another contentious question is, what do the vaccines actually do? Do they stop people from contracting the virus? Do they stop people from spreading the virus if they already have it? Now, given Nigeria's perennial struggle with electricity, what is the nation's plan to freeze vaccines which must be kept at a certain temperature? Do the 30 states of Nigeria have the capacity to preserve the vaccines? What kind of planning have they done to prepare for the administration of the vaccines? All right, stay with us. We take a short break. When we return, we'll be going on to our discussion on the growing number of infections, COVID-19 infections in Nigeria, and the possible access to vaccines by Nigeria and the rest of the developing world. Stay with us. Thank you so much for staying with us. Well, the Presidential Task Force in Nigeria says Nigeria has officially entered a second phase of the coronavirus pandemic. Like most other countries in Europe and the Americas, Nigeria is experiencing very high levels of infections in the last couple of weeks. Indeed, in the last couple of days, the figures have been very alarming. Only last night, Nigeria recorded 1,145 new infections. The figures have never been this high, even during the first phase of the pandemic. Now, that has made it very worrisome indeed, especially against the backdrop of the fact that the PTF says most states are not conducting the tests that are required to be conducted. In most cases, in some cases, only 17 or sometimes 18 states have been giving us the results with those high numbers. Now, what happens if all the states and all the testing centers were to be put to good use? It will mean that not just 1 out of 5 tests would turn out positive, but possibly a lot more. And this is a festive period, a festive season. The Christmas and New Year seasons are here, and people are expected to crisscross the country, move around, hold family gatherings, and indeed, in some cases, religious and social gatherings. Now, coupled with that is the fact that, yes, the world now has 2 or 3 vaccines that it can use in combating this pandemic. But how much access will Nigeria and the rest of the poor world have to these vaccines, especially as most of the rich countries appear to be cornering all of those vaccines? These are the issues we'll be looking at today. And I'm joined on the program virtually by Professor Morenike Oluwatoyin Folayan. She is of the Faculty of Dentistry at the Obafemi Awolowo University in Ife, and one who has done a lot of work on COVID-19 pandemic. Thank you so much, Professor Morenike Folayan.
Pleasure to be here. Thank you.
Welcome. Also joining us is Professor Oyewale Tomori. Professor Tomori is a former president of the Nigeria Academy of Sciences. Thank you so much, Professor, for joining us.
My pleasure.
So, Professor Tomori, let's begin with you. What would you say accounts for the very high levels of infections that we are seeing in Nigeria in the last 2-3 weeks, and especially in the last couple of days, where we have recorded, in some cases, 700 and something, 800 and something, and last night, 1,145?
I think it's the accumulation of our perennial lack of respect for obeying preventive measures. What we're getting now is maybe we're seeing the beginning of the true reflection of our decadence in not following the guidelines for prevention. The figures we've been seeing before, our worry should not be now. It should have started a long time ago. I think the highest we had about July was about 790. And then we had a law, which I think to me was a fake law, because we were not testing, we were not, country states were not testing and all that. A lot of our labs didn't have reagents. So we got the lower numbers because of the number of tests we're doing. Now I think we're back to testing more samples and we're getting what we actually should be getting. The 1,000 we got yesterday to me will probably be the beginning of greater numbers to come if we continue testing properly and if we continue to disobey the laws of prevention, which is, wearing your mask and all those things. Everybody has said it. I used to joke that the only person wearing mask in my town is the masquerade. The rest of us are not wearing. That's the problem.
So why do you think that Nigerians have suddenly felt that they have overcome the virus and has resulted in this reckless attitude to the pandemic?
We will never, again, it's unfortunate. We have a government that we don't trust and the government that doesn't trust us. So when they bring out figures, nobody believes what we're saying. Because they themselves, sometimes the figure they're giving, they're not backed with facts. I mean, it's incomplete figure. And so we've lived through series in independence of never believing our government. And so whenever they say there's nothing, then nobody believes them. Until you can see thousands of people dying, you don't see that what is happening. So now we've been led to believe that the problem is not there. But we're seeing that the problem is there. And occasionally, who do you hear dying of COVID in our newspapers? You don't hear of the local man in my village that is dead of COVID. It's only when the chief of staff to the head of state dies or one minister, one governor gets infected that we have it in the newspapers. What about the rest of us who also get it?
All right, but Professor Folayan, let me turn to you and ask whether or not it is possible that the resurgence of the virus in Nigeria may have something to do with migration. Can it be that a lot more people are traveling from Europe, from the Americas, and from the other parts of the world into Nigeria, and in spite of the tests that are supposed to be carried out at the entry points, both in Nigeria and even from the countries where they are coming from, that there may be some people who are actually bringing in this new strain of virus?
Thank you for that question. But first, I would disagree that it's a resurgence. I completely agree with Professor Oyewale Tomori that what we have is we're starting to see a reflection of what is happening. For the most part, we do understand largely that there are multiple factors that are made our prevalence seem low. And for me, one of the things that's made it seem low is the poor testing. Many people go testing because they're ill, not because we are looking for them. And we do know that the majority of those that are ill are those that don't have symptoms. They are those that are young. So what I think is happening is because of the school reopening, you're now seeing more people get infected, and then you're seeing people come to test. I actually don't even think that the figures we have that you're making an issue of is a reflection of what we have at all. People that are testing, we're not going out to test. People are coming to test centers to test. It is people that feel ill that are coming to the test centers to test. The majority that are not feeling ill or feel very mildly ill or are okay enough to go into the chemist to buy medications are not coming out to test. So we've always had a problem. It isn't a resurgence. It's just now that you're having more people getting into severe states and coming to test. For example, the mass testing in NYC camp brought up a lot of things. So I don't think it's people coming out from outside. It has a part to play. I don't think it's the major part. It's that we've had a problem in the country and we had not addressed that problem. And if I could just add an extra, is that yes, there was a survey that was conducted in 15 countries very recently by the African CDC that showed that in Nigeria, 76% of people were interested in vaccines, and I'm sure you're going to get that. But the majority of those that were not interested are people saying things like they have not seen people with COVID. And it's strange that you have to see death for you to believe. But just like Professor Tomori said, it's because we don't trust. And the people that can pass the message enough for the community to trust are not engaged. You go on the media, and that's not how our people get to understand and get educated about these things. I think I'll stop there. So in summary, for me, it's not a resurgence. We've always had this problem. We're just seeing it being magnified. And yes, people that come in may be part of the problem, but they're not the major cause of the problem. We've had this before. I even heard the PTF coordinator implied that it is very likely we've had COVID before December, before the first case in February 27. We had this in the country. We just detected it late. Over. Thank you.
So are you saying, Prof, for instance, that it appears that we are not doing enough engagement with communities, with our people, to sensitize them to this pandemic? Is that what you are saying?
I'm not implying. I'm saying it black and white. We're not doing what we're supposed to do. If you want, brilliant thing you're doing, AIT, brilliant thing you're doing and announcing. But we do know that for you to have a behavioral change, it's not sensitization and awareness, it's education that makes behavior change happen. And that is an engagement with people you trust. You are with them 1, 2, 3 times. It's not a one-off talk or that flash on the phone. It's education, it's contact, a minimum of 3 times. You hear the same thing a minimum of 3 times before the first hit gets to you. And then you do it from the mouthpiece of those you trust, using mediums that you trust. Where's the system in the country? What you're doing is surface, and for the elites, who are the minority, the people in the streets that don't even know that when they are sick, they go to the drug chemist. They don't even know there's supposed to be a test. There's no tests in the locality. If I want to test, I'm in the teaching hospital. I have to travel to Oshobo. I won't even do that if I think I have COVID. If I can't manage it, is when I'll go to the hospital. How will I go to Oshobo to go and test? So no, we're not doing enough. And what to do is clear, but we're not investing in what to do. We're investing in high-profile things that are not reaching the people, and therefore we're having this problem.
Now, the PTF has, in the last couple of weeks, been crying out very loud that not enough testing is being done. Now, the high figures that we have seen so far appear to be coming from less than 20 states on a regular basis. Some of these other states are not testing at all, even when they have testing centers. When it all started, we had very limited number of testing centers. But as of today, we do have quite a number. Almost every state has a testing center. So why is it that we are getting very high figures from fewer testing centers across the country?
As far as I'm concerned, that is, for me, is what I am saying is the problem. Number one, we have 36 states. We have 774 local governments. Your testing centers are less than 50. I might be wrong, but definitely they're not in all local government. And like I said, even I am a doctor, a professor. If I'm ill, I have to go to Oshobo. I live in Ife. Who's going to do that travel to get tested? Except you are ill. So the results you're seeing are results of persons who feel ill and go to test. If you truly want to know and control this pandemic, you have to make testing centers available everywhere so that people can walk in voluntarily, whether ill or not, to get tested. So that those that are asymptomatic, you can pick in time, manage, and prevent them from transmitting to others. We have a lot of people who are asymptomatic and are walking free and are spreading the virus. And because they don't feel ill, they're not wearing their mask. People are playing around, hugging them. And so we can't control the pandemic. The test centers are too few. Where you want to do tests, you go out and meet people where they are. You have outreach vans. Not ask millions of people to come to 20, 30, 40, 50, 70 centers for 200 million people. You can't get results. And so if at this time we're getting 170 people positive, it's people that have symptoms and feel ill and are going to get a diagnosis, not people walking in freely because they want to check themselves. So we definitely have a problem in the community, and we are having unchecked spread because of a large number of asymptomatic persons who get it, who are free enough to spread, because we're not containing it by diagnosing them early and enabling them quarantine or isolate, whatever the case may be. Over.
All right, Professor Tomori, let me come to you. What do you think we need to do at this point in time as a people, as a country, as governments at every level, state, federal, local governments, to arrest the situation? Now, you see what is happening in Europe and in the US. In spite of all the efforts that they are making, the mortality figures are on the rise in the US, in the UK, in Italy, in Russia. Mention it. These are places that have better health facilities than we can ever imagine having here, yet they are facing this kind of problem, this kind of crisis on their hands. What do we need to do? Because you recall that some of the isolation centers were actually shut down after a while, but most of them are now being reopened. Do they have all it takes to manage the current situation?
Thank you very much. Let me quickly add just one of the questions you raised about whether those who are coming from outside are creating the problem for us. Between week 42 and week 48, I think about 50-something thousand travelers came in. We have only been able to test just about 13% of those ones, because they said when you arrive, go and test yourself 7 days after arrival. We have only been able to reach 13% of those. Of those 13% we have reached, they are contributing just about 5% of the number of cases that we have in the country. So the remaining 95% of the cases we have in the country, even though we're not checking all of them, 95% of it is coming from within the country. Just like Morenike said, it is a spread that is going on within the country. So let's not blame outsiders. They are making a little contribution, but it's not that major problem. Now back to the question you asked, what do we do? We should have done, we should be doing what we should have done a long time ago. And what did I mean by that? The government should have, the important person in the transmission is not the virus, it's the people who carry the virus from one person to another. Therefore, if you're going to stop this transmission, you have to do something about the people. What do you need to do? I don't want to get infected. I don't want to transmit to somebody else. So what do we do? Wear your mask, wash your hands, keep that distance. Avoid all these big things we are doing now, churches, vigils, and all those kind of things. Stay at your home and avoid, getting into close place with all this. Those are the basic rules that have been used in other countries. I think we're particularly lucky in Africa, let me put it that way, that COVID is not behaving like it's behaving in Europe. If they were behaving like that, all those predictions about dead body all over the place, we should have been seeing it. So rather than us claiming victory over COVID, COVID has not behaved like that in other parts. And therefore, we should have taken advantage of that to prepare ourselves better. But we didn't. Instead, we took it for granted that, oh no, COVID can't do anything to us or whatever. But it's doing something to us. And when you look at usually we count numbers and say, 700,000 people or 70,000 people died. But then if that one is your person, how will you feel? So take it, not the statistics of Nigeria, take it as you among the 70,000. Supposing I was one of those 70,000 and I'm the breadwinner for my family, what will happen to my family? Then I should take that personally. Government made a very serious mistake by giving the impression that they were the one controlling the epidemic. They are not. It is the people who control the epidemic. And if you don't reach them, if you don't get that information to them, we're going to be talking about vaccines hopefully soon. Now, which information are we having about vaccines in this country? It is the rumors and the listen that are going on. Government is not saying anything. It's not providing the fact to counter all those rumors. That is where we failed at the beginning, and that's where we're going to fail again with this vaccine when it comes to it.
Is there a possibility, Prof, that with these rising figures, government could consider taking some very stringent measures similar to what we are seeing in parts of Europe?
Well, for example, ideal thing would be persuasion. Get down to the people and convince them of what they're doing. But where they won't, where you have failed in doing that because of your fault, you may have to begin to use force. I hear, Don shows you showed the CDC man was saying, if anybody was coming to your office, don't let him enter. If he doesn't wear a mask, if you don't do this, then those rules must be strictly obeyed. And it is not the leader of the hotel to do it. You yourself must be able to participate in that. I got into a hotel a few weeks ago, 2 weeks ago in Abuja. The guy at the reception was not wearing his mask. The other person there was nowhere. I said, I'm not entering this hotel until you people put on your mask. And I said, oh, I have my mask. And he put it up in his pocket. And I looked at him and I said, is your nose in your pocket? Is your mouth in your pocket? This mask is also be on your nose and you're not in your pocket. These are the things that each of us must continue to do, that anywhere we go, any opportunity we have. Not that the government alone, all these things you hear on AIT and all those things. Me, I become the AIT for my community, so that I can tell the people that, look, don't put that in on. Don't greet me if you don't have your mask on your face. Then we all combine together and we can bring this under control.
Thank you, Prof. Stay with us. We will go on a short break, and when we come back, we will be looking at the access to vaccines by Nigeria and other developing countries of the world. My guests are Professor Oyewale Tomori and Professor Morenike Folayan. Stay on. Thank you so much for staying with us. Professor Folayan, the world now has vaccines. At least Pfizer has developed one, and of course, we also know of the one developed by Moderna, and another, a third company, is also on the way. Now, the Nigerian government says that by the end of January 2021, Nigeria should be expecting the first batch of vaccines for administration in Nigeria. Now, given what we know of the development of the vaccine and of its distribution, and the fact that most rich nations of the West have acquired, if not all, but at more than 90% of what is available, can we realistically be expecting to have vaccines in Nigeria by January 2021? Prof, are you with us?
Me or Morenike? I thought you were asking Morenike.
Hello, Prof. Folayan. All right, let's hope that we are able to rejoin Professor Folayan. But Professor Tomori, I don't know if you heard my question.
Yeah, I did. I heard your question.
Okay,
I thought
please.
It was for Morenike.
Yes.
That's why I didn't answer. You want me to answer now?
No, go ahead. No, go ahead, Prof.
Yeah, thank you very much. You know, the only where you said the world, other countries in the world have bought up the vaccines. Not only have they bought up the vaccines yet produced, they have bought up the vaccines to be produced for the next 6 months. Europe, for example, Canada has bought 5 times the number of doses they need for their people. UK has bought 4 times the number of doses they need. European Union has bought even twice that amount of money. Africa is begging for one to even vaccinate 1/5 of our people. And it's coming through the what we call the COVAX. COVAX itself is not even sure what vaccine it's going to get. So, I'm glad the minister said we're expecting by January. He didn't say we will get it by January. So it's all a dream for me, as far as I'm concerned. Because right now, we don't even know which of the vaccines you and I are going to get. And if indeed we're going to get this vaccine by January, by now, the government should have been preparing on ground information to our people, who will be getting it, where they will get it, what type it is, or not which one are they getting, how much we're going to get. But that information is not there. So because I'm sure believers, they don't have the information themselves. So we're all living, I used to say something about this diplomacy and all this kind of thing. When diplomacy between unequals, this is what happens to you. You end up with dictatorship, they dictate to you, and subjugation. If you bring nothing to the discussion table, you get the rotten deal. If you bring your raw material, you get a raw deal. And that's what is happening to us. We are bringing nothing to the COVID vaccine table. And therefore, we're waiting until the crumbs come to us after they have satisfied themselves. And they will not do that until they will not bring anything to you until they are sure that their people are protected. They care about their people, but we have government said I don't care about nobody.
So this tends to indicate that there's a possibility that it could aggravate the global inequality that already exists.
Were you expecting this one to solve that problem? No way. No, inequality will remain because we will not do the right thing. Inequality, exactly. When you're talking about inequality, inequality starts from you. Each of us have the capacity to contribute something to the field, our own talent in different ways. But we will refuse. We will be wringing our hand and begging, no, we are a poor nation, we are this and this and that.
Exactly.
There was a time when Nigeria was the diaspora for Indians and Ghanaians until we told them to pack their bag and go. What did we do at that time? What made it possible for Indians and Ghanaians to come to Nigeria? That now Nigerians are going to other countries as diaspora because we refuse to identify those talents that we have. And we refuse to bring that to the table. To say, look, this I have, you have this one, we bring it together. We are depending, totally depending. Some people were complaining that South Africa was getting involved with vaccine trial. Why not? Why do you want to be a consumer nation all throughout without participating in what is going on? South Africa now can, with boldness, come out and say, I want some vaccines because I also participated in the trials. But what did we do? We're carrying rumors about that the vaccine is not good and this and this and that. So-called big men, and sorry to use the word stupid people, carrying rumors about this, which they don't know anything about. They cannot have information about. They tell you an unknown body told me. Liars, all of them. And they are the one causing more of the problems in this country. Until we begin to recognize the capacity that we have in our country and make use of that capacity in challenging together and discussing, we will continue to have this inequality or inequality or whatever you call it.
It appears Professor Folayan has rejoined us now. Prof.
Yes,
okay, we still hope that we are able to reconnect with Professor Folayan. Right.
I'm here.
Okay, yes.
I'm here.
Yes, Professor Folayan is with us now. Thank you very much, Prof. Now,
yeah.
This whole question of access to vaccines, is there anything the UN, through the World Health Organization, using the instrumentality of the global value chain, can do to help poor nations like Nigeria?
They have done all they need to do. It's the country they have done. African CDC has done. They have provided, World Bank has provided facilities. The Friendly's Bank has provided facilities. It's the country. There's nothing anybody can do. Even what the country chooses to do. We're talking about a vaccine that they promised, like Professor Tomori said. In January, I'm glad they know, it was speculated. There's so many things that is obvious would not make it happen. But having said that, this is a vaccine that is going to be given to adults. We've never given vaccines to adults. What mechanism is in place to get this? Nothing. We're only signing and shaking hands. It's a vaccine that is going to use a cold chain that has never been used, even in the US. Nothing. We're still signing papers. It's a vaccine that we have to prioritize because not everybody is going to get scarce community because we need to get on board now. Nothing. We are still signing papers and shaking hands. Nothing. We're not even telling people, the public, and at least the public is not people listening to AIT and looking at the phone. But where we get things to the community, town criers, the community leaders, nothing. They have not heard of a vaccine. Yet they're waiting for a vaccine to come in January. Even if Pfizer left Nigeria and decided that it was going to give 400 million doses free to Nigeria tomorrow, or even that January, that the president or the minister says, even if they love us so much, and says they're collecting all the vaccines from the world, and we're going to give 4 million doses to Nigeria in January. Tell me, beyond the people in Aso Rock, tell me which persons are prepared to take it. Nothing. That vaccine will just spoil inside the ship because there's nothing looking at the freezers, there's nothing looking at dissemination, there's nothing looking at logistics supply. There is nothing. It is nothing. It is we. It is we. Everything is available if we want to get that vaccine. You scramble in that state, medically, there's facility, there's money. There's nothing. Or maybe there's something that is happening and nobody knows. But as far as me walking in the field, there's nothing. I will not heard anything beyond the newspaper that showed that they signed with Gavi and Mama Ngozi promised that it will come in January. Over.
Prof, assuming that these vaccines come into Nigeria in January, as we have been told, by the end of January, how prepared are we as a country, as a government, or as governments at every level to administer these vaccines? We have seen the trail in other countries where it is stored under certain conditions. In Nigeria, we are struggling with electricity. We have very hot weather. Do we have what it takes to preserve these vaccines and make them useful when we need them?
I think you've asked an excellent question, and I've tried to answer it in my previous statement. But having said it, that vaccine, there was no country in the world that was prepared for its storage. That temperature is -70 or something. No country had that kind of cold. The serious country chose to make it happen for its people. So if Nigeria wants to have it, there's nothing impossible. If all our senators decide to give 1 month's salary, we will put it in place. Believe me, just 1 month's salary. The other 11 months, they can keep it. Just 1 month's salary. They should forfeit it for COVID vaccine. You would get the logistics in place. The brain to make it happen is here in the country, but we have chosen to keep quiet to the last minute. And this is my concern. We're always waiting to the last minute. We wait for crumbs. We are waiting for donors. There's no donor in this COVID vaccine. I don't know if you've noticed. Every country is looking after itself. There is no donor anything. I mean, very minor. That might be an exaggeration. Maybe very little. They still come around, but the country has to respond. The country has not responded. And I don't know what miracle they want to do. For me, the sad thing is that this country is once again going to be left behind with our ineptitude with the way we're handling COVID vaccine. Let me tell you what I think. It's my perception. The world is taking this COVID vaccine, and they're cutting their transmission. They're going to save their country. And therefore, countries that citizens do not take the vaccine, it's a matter of time. You can't travel. You can't come. Because just like now, yellow fever you must take yellow fever vaccine, then you must take COVID vaccine for you to travel. So for Nigerians who are very deep trotters, you can't even travel. It's going to happen. It's a matter of time. Because the virus will be here with us for a long time. The large number of asymptomatic carriers will make this wave. We will have third wave and fourth wave and fifth wave. It's the vaccine that will cut that transmission and stop that wave happening. And the world will just move and they will leave us. Whenever we are ready, they will admit us back into the economy of nations. Yeah. But it's nobody's fault. It's our country's fault. Nobody. It's everything. If we want to act, everything is in place for us to act. We're just choosing to wait for one donor to come and act for us, or maybe COVAC will now tell us what to do. We're just not ready. That's all.
Professor Tomori, that picture painted by Professor Folayan sounds very scary. That if we do not put our act together very quickly, we might be left behind by the rest of the world, and we just might be an isolated country.
Morenike has been too nice to Nigeria. What she painted is even too nice, because the situation in Nigeria is worse than what she painted. This is a country. Let me give you an example. You are preparing a party for me on paper. You didn't tell me what I'm going to do. And then you say, party is coming, but you don't let me know what you're doing. So government tells us we're preparing. But who knows what they're preparing? For example, which group are we going to get the vaccines to first? Is there any priority group list we have on ground? Is there any group we think we should be looking at and say, these are the people that should get this in? Even if the vaccines come, do we have the logistics and things in place? And now you're talking about whether it's not that whether we have the resources or not. I believe we have resources in this country. This same country was not the same country that budgeted 500 billion or something for COVID. How much of it went to COVID? Go and find out. One quarter of the money didn't go into COVID. It went to other things, which had absolutely nothing to do with COVID. each of these states were given 1 billion or something like that each to deal with testing or something. Is Kogi testing? Is crossover testing? Is anybody asking what they did with that 1 billion? So we wasted some billions, into the pockets of some people in the different states. When we could have garnered this all money, when people were asking, when other countries were buying and paying for vaccines, we could have used some of this money better than giving it to states and governments, state governments to spend at their whims and caprices, and without anybody asking them what the situation is. So the way I keep saying it, the talent is there. Nigeria has all it takes to do what it wants to do, but we will not take all we have, and that's the problem. We would rather depend on other people to do those things for us. Those basic resources, it's 60 years now. NCDC was telling us how we built 90 new laboratories in the last 9 months. What were we doing for the last 60 years as a country? Is it now the time to start building laboratories? Shouldn't it be the time when those laboratories should have been in place? What we call success is actually catching up on the failure of the past, and we call it success. So when Morenike painted the situation, it's even grimmer than that. And I think it's going to be worse. When those vaccines come, you will see the disaster that we have as a country, because we will not plan ahead. And even when we plan ahead, we will not sustain our plans. These are the issues, and these are the things we have been talking about all the while. It is not that we don't have the people, it's not that we don't have the talent, but we will not harness all this together. We would rather wait for Bill Gates to come and tell us what to do, or COVAX to tell us what to do, when we have the wisdom and the things to do what we need to do.
Is there a possibility, Prof, that at the end of the day, we just might be exploring the black market to get vaccines, and maybe not get the authentic vaccines at the end of the day, if we do not do what is required and necessary at this point in time?
Markets.
I want to believe that, let me put it this way. Nigeria has been discussing with quite a lot of people, which I think the vice president was discussing with Pfizer. The Russians came to us and started talking to us. UAE, of our country, also came to us to come and sell vaccine to us. But we don't have a coordinated approach to all those things. That's what we require. We need a coordinated approach. I don't doubt anything about my country. I would believe what you said. Somebody is going to wake up one day, one businessman going to work one day and go to India or somewhere and bring in so-called and say COVID vaccine. And our people will buy those things. We will patronize it. That is the danger that when I said Morenike did not paint as serious, that's the danger we have. We have no regulation, we have no law. Anybody can walk into any place, get vaccines, and put it in his pocket, in his bag, bring it to this country, and people will still go there and get it. That is the danger that we have. If the government will only do its work properly, ensure that they have this coordinated, and inform the people where to get the vaccine, who to get the vaccine, so we have the information, and people will not be misled by all these fake rumors and fake stories that are going around.
Professor Folayan, on a final note, what would you say is the way forward for us now? Is Professor Folayan still with us? All right.
I think
let me turn back to Professor Tomori for his
the way forward
closing thoughts.
Is to do what is right. The way forward is to do what is right, what we should have done from the beginning. Prevention. Vaccine alone is not going to stop the epidemic. It will limit and reduce it. But the message is still that it's not everybody that gets the vaccine that will be protected. So, you find the protection rate is not 100%. Some people will still not react and listen. People will still be around who will not take the vaccine. The vaccine will still not reach everybody. Therefore, we still have a large proportion of our people who will be exposed, and therefore we need to do all those preventive measures side by side with the vaccine. Vaccine will help us, but it's not going to solve the problem. So continue with the face mask, keep washing your hand, avoid all these big distances and these Christmas carols and this thing. Forget it for this year at least. Let's see what happens, before we continue. Therefore, when the vaccines come, it will also help us. It's a combination of so many parts of it working together. If you leave out one part, you have your problem. So let's do what is right now, what we should have been doing before. And then if the vaccine eventually comes, then, but let the government tell us details of where and what they are doing how many vaccines doses we are getting, when we are going to get it, where they will be delivered, who will get it first. With that information, then people can act with the government.
Thank you so much, Professor Tomori. Professor Folayan is back with us now. Your closing thoughts on the way forward.
Yes, I'm not sure you can hear me now,
Yes.
but I can hear you.
We can hear you.
Yes, okay, excellent. I think I can concur more with Professor Tomori that vaccine or not, we need to get our people to understand even the basics around that. Community engagement is really poor. Media engagement is really poor. Invest in that, and that is cheap. Sadly, we don't do the cheap one, we go to the expensive one and leave the cheap thing that is very effective. So there must be investment in community engagement and media engagement so that our people get educated on how to prevent. And then, of course, the vaccine is important. We need to plan strategically, put together. PTF is there. I have a concern that PTF seems to be planning to disband in December. I think it's too early, to do that. He must ride this through. And at this critical time, we need coordination around a COVID access response. There is not, even in the past in Nigeria, at least you put things on paper. Paper does not even translate to anything. At least even do that one. Let us have a plan and then start to invest in the way to get it, even if it's 2022. Please let us start planning. Even if it's 2022. But I definitely, it would be a miracle of a lifetime if January is real. I think that was a joke, like every other joke. And nobody asks anybody to account about. People just say things and nobody asks them to give account of what they say. They just move forward. That was a joke.
Thank you, Prof. Yes, let's leave it at that. Thank you so much, Professor Morenike Oluwatoyin Folayan. He is of the Faculty of Dentistry at the Obafemi Awolowo University. And we're also joined by Professor Oyewole Tomori, who is the former president of the Nigeria Academy of Sciences. And you have heard them, you've listened to them. There is need for every Nigerian to observe the guidelines and the protocols while we await the vaccines to arrive in Nigeria. The vaccine will only complement our responsibility to ourselves and to our neighbors and to our co-workers, to fellow human beings in our neighborhoods, everywhere we are. We must continue to observe those guidelines. Thank you, Profs, for your time, and we look forward to having some more engagement with you in the near future. Thank you so much.
Thank you so much.
All right, that's our program for today. Please join us again on Monday when we bring you a fresh edition of People, Politics, and Power. Bye for now.